Hi everyone, this is a demonstration of the Healthcare Provider Training and Monitoring application developed by Dimagi. This application is built on Dimagi's open source platform, CommCare, and is available to be used free of charge. This is a template application. Any organization that supports healthcare workers can download it and edit the content to fit its needs. This application serves two main purposes. First, it allows healthcare providers to regularly screen for COVID-19 symptoms and assess their risk of exposure. Second, it helps healthcare providers learn more about COVID-19 as well as how to properly protect themselves, how to protect their families, and how to support their mental well-being during this time. To create this application, Dimagi drew inspiration from the CDC's symptom screening tool, as well as numerous tools and protocols published by the World Health Organization to support those working in healthcare settings. Let's get started. After logging in, I will click on Start to enter the application. First, I will need to select my name from the list of healthcare providers. If I do not see my name on the list, it means I'm not yet set up as a user of this application. I will need to register myself by clicking on Register a new healthcare provider. This is a really brief form that captures some basic information about a healthcare provider in order to add them to the application. For the purposes of this demo, I will be Laura Makani, who works in the medical unit as a respiratory therapist. I'll click here, confirm this is indeed me, and continue to enter the main application menu. Here we see several different forms. The symptom monitoring form allows me to quickly screen for COVID-19 symptoms. It also provides precautions I should be taking. The risk assessment form will assess my risk of possible COVID-19 exposure. With the suggestions for facility improvements form, I can submit ideas and suggestions with my name or anonymously. The Edit Healthcare Provider Information form allows me to add or update my information on file. Education will take me to the Education module, which I will demo in a few minutes. Let's get started by completing the Symptom Monitoring form. First, I'm asked to confirm my identity. The reason this is asked is because the application may be installed on a phone or tablet that is shared among all the providers at a facility. If this is not me, the app instructs me to go back and select my name from the list. I will not be able to proceed in the form. Next, there is a screening of critical COVID-19 symptoms. The app asks whether I'm experiencing any of the following symptoms. If I were to answer yes to this question, the app tells me I am experiencing critical symptoms and prompts me to seek immediate emergency medical care. We will say we're not experiencing any critical symptoms. Next, there is a symptom screening. These are all symptoms that may be indicative of COVID-19 infection. Next, the app checks whether I have any chronic or underlying conditions that may affect my susceptibility to COVID-19. Let's say I have none of these. Next, the app checks for COVID-19 exposure. In the last 14 days, have you traveled internationally? No. In the last 14 days, have you been to an area where COVID-19 is widespread? Let's say no, I have not. In the last 14 days, what is your exposure to others who are known to have COVID-19? Since I work in a healthcare facility and I am exposed to confirmed cases, I'm going to say I've had close contact with someone who has COVID-19. Finally, the app provides recommendations and precautions based on the answers provided in this form. There are some next steps I should take, as well as an infographic. The last screen thanks me for completing the form and prompts me to complete the form again in 1 to 2 days. Remember, all of this is completely editable and can be adjusted for your organization's needs. I finish the form and I'm back in the main application menu. Next, let's complete the risk assessment form. Again, the app asks me to confirm my identity. I confirm. First, I'm asked whether there are currently any confirmed COVID-19 patients at the healthcare facility. I'll say yes. It asks the number of patients. I can approximate the number if the exact number of patients is not known. In this next section, I fill out how much exposure I'm having with confirmed COVID-19 patients, such as whether I provide direct care to confirmed cases, whether I have face-to-face contacts, whether I was present for any aerosol-generating procedures, I can see these below, whether I had any direct contact with the environment where the confirmed patient was cared for, and finally, whether I was involved in any healthcare interactions in other healthcare facilities. Next, the app asks me about my adherence to IPC procedures during healthcare interactions. For the following questions, I'm asked to quantify the frequency with which I wore PPE. So we have face shield or goggles, protective glasses, disposable gown, medical mask, single-use gloves. In this next section, I'm asked in the same way to quantify the frequency with which I was able to adhere to the guidelines. These are about removing and replacing PPE, performing hand hygiene before and after touching patients, performing hand hygiene before and after clean and aseptic procedures, performing hand hygiene after exposure to body fluids, performing hand hygiene after touching the patient's surroundings, and finally, whether high-touch surfaces were decontaminated fluidly. Based on the answers I've provided in this form, the app's algorithm has assessed my risk to be high. I can also see my previous risk assessment outcome and check whether it has changed. At the end of the form, I'm thanked for completing it and asked to complete it again in 5 to 7 days. Remember, this is completely editable. That means you can set the number of days to any frequency you would like your staff to complete this form. Next, we're going to submit a suggestion for facility improvements. Here, I am asked whether I would like to submit my suggestion with my name or anonymously. Now, I'm asked to check the area or areas of improvement that my suggestion falls under. Next, I'm asked to type a brief description of the improvement and how I think it can be resolved. I'm asked to indicate the urgency, as well as who I believe is responsible for this improvement. On the final screen, I have a summary of the information I entered in this form. I can confirm this information and then click Finish to submit. Now, let's take a look at the Education module. When I click on Education, I find 5 additional forms. We have a COVID-19 Q&A form, a WASH form, a form that tells us the proper sequence for putting on PPE, or personal protective equipment, a mental health and stress management form, as well as a risk education for families form. Let's take a look at the Q&A form. Here, I'm able to select any of these commonly asked questions and find the answer to it. The answer will either be in the form of an infographic, as seen here, or in the form of a video, as seen here. When I'm done going through the questions I want answers to, I click Submit to finish. Next, we have the WASH form. Here, I'm able to select the areas I would like to know more about. Alternatively, I can simply swipe through the form to see all the available content. Let's say we want to take a look at hand hygiene and cleaning practices. In the section for hand hygiene, I have some basic instructions here reminding me of the key messaging. I can take a look at the 5 moments of hand washing as defined by the World Health Organization. I can see the proper way to wash my hands if my hands are not visibly dirty, as well as when they are visibly dirty. Next, let's take a look at cleaning practices. I have some key information here, as well as more information about what constitutes a proper disinfectant. Here, I'm reminded that anyone dealing with soiled bedding, towels, and clothes from patients should be wearing the appropriate PPE. Here, I'm instructed about how to dispose of soiled linens. This section tells me about how to properly wash soiled linens. Next, let's take a look at the sequence for putting on PPE. It takes me through how to put on a gown properly, a mask or respirator, goggles or face shields, and finally, gloves. Next, let's take a look at the mental health and stress management form. The contents in this form are drawn from a WHO publication for healthcare workers. It covers some key messages about emotions they might experience and how to handle them. the importance of maintaining a healthy lifestyle, reminders to avoid smoking, alcohol, or drugs to deal with emotions, a reminder to get their facts from credible sources such as the WHO or public health agencies, advice to watch less media coverage that might be upsetting, and finally, to draw on skills you have used in the past to help you manage life's adversities. This is a form that healthcare workers can refer back to whenever they're feeling stressed or overwhelmed. Finally, let's take a look at the Risk Education for Families form. This form takes a healthcare provider through the right precautions to take at work, as well as at home, in order to keep their families and loved ones safe. It covers aspects such as proper hand washing techniques, recommendations that whenever possible, healthcare providers should use their own dishes, utensils, and should never share a toothbrush. Next, it goes through best practices when it comes to cleaning, how to clean soft surfaces, how to disinfect electronics, how to properly do laundry, and how to properly take out trash or garbage. Thank you so much for watching the demo video for the Healthcare Provider Training and Monitoring app. Remember, organizations can easily modify all application content using CommCare's turnkey application builder. For additional documentation and instructions on how to download a copy of this template application, please visit www.dimagi.com/COVID-19. Thank you for your time.